The United Nations top diplomat is sounding the alarm. On Wednesday, Secretary General Antonio Guterres invoked Article 99 of the UN Charter, warning the Security Council of an impending, quote, humanitarian catastrophe in Gaza, an article that has been triggered only 4 times in the United Nations history. But on Friday, the United States vetoed the UN resolution calling for an immediate ceasefire in the Israel-Hamas war, despite this dire warning and international pressure. Guterres' warning comes as no surprise when you take a look at the utter devastation in Gaza. And tonight we wanted to just take a look at some of these numbers to put it in context. Since the start of the war, satellite data shows that more than 60% of the buildings in northern Gaza have been severely damaged by Israel's counteroffensive. In some districts, that number is as high as 70%, with whole neighborhoods reduced to dust. This level of damage may be hard to comprehend, but consider this. According to a new report from the Financial Times, the catastrophic destruction that we have witnessed in northern Gaza has already surpassed levels seen during the Second World War. From 1943 to 1945, the Allied forces' relentless bombing of German cities only destroyed an estimated 50% of urban areas, meaning that just within a matter of weeks, Israel's air campaign, its ground assault against Gaza, has already become one of the heaviest in history. And the healthcare system has been pushed beyond the breaking point. Since October, the number of functioning hospitals in Gaza has been slashed in half, dropping from 36 to 18, according to the World Health Organization. And of these 18, only 3 are providing basic first aid. The remaining 15 are delivering partial medical services. Right now, the 12 hospitals operating in southern Gaza are serving as the backbone of the Strip's entire hospital system. And hospitals able to admit patients are being stretched to the limit, delivering services well over their intended capacity, with some treating 2 to 3 times as many patients as they were designed for. And that's because Palestinians from northern Gaza were forced to leave their homes and flee south after Israel ordered them to evacuate. Now, the UN Palestinian Refugee Agency says around 1.9 million people in Gaza have been displaced since October 7th. Unfortunately, displacement is part and parcel of war. But I just want to put this in perspective for you, just to show you how staggering that number is. Since Russia's invasion of Ukraine in 2022, the UN estimates 5.1 million Ukrainians have been internally displaced, and more than 6.2 million have fled the country. That's nearly 30% of Ukraine's population. And it's an astonishing figure. But by comparison, that nearly 2 million Palestinians who have been displaced over the last 2 months, they make up more than 85% of the entire population of Gaza, almost triple the amount in Ukraine. And with that short-lived ceasefire now over, the death toll in Gaza only continues to climb by the day. Since October 7th, more than 17,000 people have been killed, according to the Ministry of Health in Gaza. That includes more than 7,000 children and 5,000 women. In terms of percentage of populations, that's the equivalent of the entire city of Chicago gone, wiped off the face of this earth. And in fact, an analysis by Yagel Levy, a sociology professor at the Open University of Israel, has found that civilians make up 61% of deaths from airstrikes in Gaza. Israeli aggression has also been seen in the West Bank, which Hamas does not govern. In the West Bank, at least 263 Palestinians have been killed, the majority of those by Israeli forces and others, including settlers. This, according to the United Nations Office for the Coordination of Humanitarian Affairs. And more than 3,000 Palestinians have been arrested, according to the UN Human Rights Office, in the occupied Palestinian territory. As for journalists who are supposed to be protected under international humanitarian law during a war, well, they haven't been spared either. The Committee to Protect Journalists reports that at least 63 journalists and media workers have been killed, including 56 Palestinians, 4 Israelis, and 3 Lebanese. The staggering civilian death toll has also prompted concerns about Israel's military approach in the region. According to the IDF spokesperson, Jonathan Kornikas, Israel is not able to verify the exact number of Hamas fighters they have killed so far, although he does put the number in the, quote, thousands. Earlier this week, Israel says it has killed half of Hamas's mid-level commanders. According to the Israeli army, at least 420 of their soldiers have been killed since October 7th, and at least 11,000 rockets have been launched from the Gaza Strip towards Israel since the start of the Israeli war on October 7th, and this according to the Quds News Network. Meanwhile, there have been at least 82 attacks against bases with U.S. troops across the Middle East since October 7th. As fighting continues to rage on into its 9th week with still no end in sight, these numbers will undoubtedly grow. But in the meantime, it is important that we understand and contextualize the sheer scale of the death, the destruction, the despair that has consumed the region in the last 2 months, where residents in Gaza have said there is nowhere left to go. After the break, I'm going to speak to a member of Doctors Without Borders who is in Gaza right now, working at one of the remaining barely functioning hospitals. Stay with us. The few hospitals that are still operating in Gaza are being pushed to deliver care far past their intended limits as the humanitarian situation continues to deteriorate. Earlier, I spoke with Marie-Or Perot-Raviel, MSF emergency coordinator, who joined me from Al-Aqsa Hospital inside central Gaza. Marie-Or, thank you so much for making time for us today. I know it is a very difficult situation. You are at Al-Aqsa Hospital right now, one of the few hospitals still operating inside of Gaza. Can you describe for us the conditions and what you and your team are seeing right now?
Well, first, it's very difficult to say that Al-Aqsa Hospital is still operating, because an operating hospital should be able to provide not only emergency care for patients, but it should also be able to provide maternal care. It should also be able to provide care for patients with chronic disease, and it's just not the case anymore. The hospital is now only providing, trying to cope with the constant influx of patients that is coming through the ER every day. Since the end of the truce, the hospital has received nearly 1,500 people through the ER, and almost 500 of them actually arrived already dead through the ER. So the hospital is in a very chaotic situation, very difficult situation.
The UN Secretary General said that the humanitarian support system in Gaza is collapsing. And with that, obviously, the medical facilities there are beginning to collapse. What is the situation like for the doctors inside Gaza? How are they able to do whatever jobs they are actually doing at the moment?
The situation is impossible. The situation of doctors in Gaza is doctors who have to come to work in the morning, just hoping to find their families and their homes back in the evening. It's the situation of doctors who have to find words. How do you find words to announce to a 5-year-old that they're the only survivor of their family who died in the bombing of their house? It's the situation of doctors who have to find ways to relieve pain from patients who come with infected wounds, where worms are inside the wounds which are infected. It's doctors who are healthcare workers who are completely exhausted from the past 2 months here in Gaza. It's just an impossible situation for them.
Is it safe to say that the conditions under which the doctors are operating is basic or even primitive? I mean, do they have necessary equipment? Is equipment sterilized? Do they have the ability to treat patients adequately? What is it that they ultimately are lacking at this very moment?
It's almost everything. It's very difficult to see through the next day. Yesterday, we were critically lacking ketamine in the hospital. The abdominal gauze, very basic medical supplies were lacking. It's extremely difficult.
Can you just tell us, I know that MSF works around the world, you've worked around the world. How does this compare to other conflicts in which MSF has operated? Have you ever seen conditions like this in which MSF, other doctors, Gazan doctors, are working under this constant bombardment and war with a lack of resources, besieged, no electricity, no food, no water, no medical supplies?
In comparison to other places, other countries where MSF is working, this is not a humanitarian response. For as long as bombs will keep on falling onto Gaza, for as long as people will not be able to find food, for as long as children will have to learn that they're the only survivors of their family when they arrive to the hospital, for as long as there will be no water, for as long as there will be no supply entering Gaza, for as long as, again, doctors will have to come to the hospital in the morning not knowing whether they will find their families and their home back in the evening. This will not be a humanitarian response. The only thing that we need now is a ceasefire. Then we will be able to provide some humanitarian relief to the situation.
Speaking of ceasefire, I'm sure you're aware yesterday the United States vetoed a Security Council resolution that was calling for an immediate ceasefire. How does that, in terms of the impact in the short term, in the immediate short term, affect what it is that you are undergoing, both as an organization as well as individual doctors operating in Gaza, that the ceasefire was effectively blocked by the United States?
Again, the conditions that we're in today do not allow us to work. Yes, we're present in Gaza. Yes, we're supporting the Ministry of Health, and we're trying to support the hospitals the best we can. But this situation, without a ceasefire, we cannot provide the support that the people need here. We were forced to suspend our operation in a primary health center that we were working in Khan Yunis about a week ago, because the health center was within a neighborhood that received an evacuation order. Without a ceasefire, we're not able to continue working here.
Speaking of that, have you had any communications with the Israeli military now in Gaza? Have they asked you to evacuate, or are you staying at Al-Aqsa Hospital despite the fact that they wanted certain hospitals across the Gaza Strip evacuated?
For now, the hospital in Al-Aqsa has not received such order, but it's almost cynical that you have to think whether the hospital you're working in will receive an evacuation order at some point, will be targeted at some point. This is just a blatant violation of international humanitarian law.
Do you fear that you
not even be something?
Do you fear that you might be targeted? Do you fear that you might be targeted while you're at Al-Aqsa Hospital?
I think we have plenty of example where hospitals have been targeted since the beginning of the conflict, and we know now for a fact that there is no safe space in Gaza, and that includes hospital. Yes.
Marie-Aure Perrault-Ravial, thank you so much for your time. I greatly appreciate it. I hope you and your team stay safe. Thank you so much for making time for us.
Thank you.
I will try to deliver this video to the world. Please do anything. There is no one doing anything about what we are witnessing right now. Do you see this? This is the view from the window I am standing in the front of right now. I am 18 years old girl from Gaza. It does not matter what my name is, because every single child in Gaza is living exactly what I am living right now with my family. There is no electricity, there is no internet, there is no water, there is no food. Basically, my home doesn't feel like home anymore. Okay, we are the victims here. We are human beings. We deserve to live.